A resident with Alzheimer's disease becomes increasingly agitated in the late afternoon and evening. This behavior is known as A. Delirium, B. Sundowning, C. Hallucination, D. Disorientation. Answer B. Sundowning refers to increased confusion and agitation in individuals with dementia during the late afternoon and evening. The CNA notices a reddened area on the resident's coccyx. What is the first action the CNA should take? A. Massage the area to increase circulation. B. Apply lotion and cover it with a bandage. C. Reposition the resident and report it to the nurse. D. Document it as a Stage 1 pressure injury. Answer C. Repositioning helps relieve pressure, and reporting it ensures the nurse can assess and treat it appropriately. When assisting a resident who is recovering from a stroke, the CNA should A. Offer assistance only when asked. B. Encourage the resident to use their stronger side. C. Complete all tasks quickly to avoid fatigue. D. Avoid using assistive devices. Answer B. Encouraging use of the stronger side promotes independence and recovery. A resident begins to choke while eating and cannot speak. The CNA should first A. Call for help and wait for a nurse. B. Start chest compressions. C. Perform the Heimlich maneuver, abdominal thrusts. D. Offer water. Answer C. Abdominal thrusts are the immediate action when someone is choking and cannot speak or breathe. A resident who is unconscious is at risk for aspiration. The best position to place the resident in is A. Supine, B. Prone, C. Side-lying, D. Fowlers. Answer C. The side-lying position helps prevent aspiration by allowing fluids to drain out of the mouth. Before helping a resident into a wheelchair, the CNA should A. Ask the nurse to assist. B. Ensure the wheelchair is unlocked. C. Lock the wheelchair and check footrests. D. Put the resident in a gait belt and immediately transfer. Answer C. Locking the wheels and checking footrests prevents falls and injury during transfer. If a CNA finds a resident lying on the floor, the first action should be to A. Help the resident back into bed. B. Notify the family. C. Check for breathing and call for the nurse. D. Report to the charge nurse after the shift. Answer C. Assessing for breathing and calling the nurse ensures immediate medical evaluation and appropriate care. Which of the following is the best example of objective data? A. The resident says they are dizzy. B. The resident appears uncomfortable. C. The resident's temperature is 101.4 degrees Fahrenheit. D. The resident says they feel warm. Answer C. Objective data is measurable and observable, such as a specific temperature reading. A CNA should wear gloves when A. Feeding a resident. B. Making an occupied bed. C. Performing mouth care. D. Brushing the resident's hair. Answer C. Mouth care involves contact with bodily fluids, requiring gloves to prevent infection. Which of the following is a sign of a urinary tract infection, UTI? A. Clear and odorless urine. B. Increased appetite. C. Painful urination and confusion. D. Decreased body temperature. Answer C. Painful urination and confusion, especially in older adults, are common UTI symptoms. The most effective way to prevent the spread of infection is A. Wearing a gown. B. Wearing a mask. C. Hand washing. D. Using hand sanitizer. Answer: C. Hand washing with soap and water is the most effective way to prevent infection transmission. When a resident is receiving oxygen, the CNA should: A. Remove the oxygen when feeding. B. Monitor for skin irritation behind the ears. C. Adjust the flow rate as needed. D. Use oil-based lotion near the nose. Answer: B. Oxygen tubing can cause skin breakdown, especially behind the ears and around the nose. If a resident with dementia becomes combative, the CNA should: A. Restrain the resident immediately. B. Leave the resident alone until calm. C. Speak calmly and redirect the resident. D. Call the physician. Answer: C. Calm communication and redirection help de-escalate agitation in residents with dementia. A resident who is on bed rest needs frequent turning to: A. Prevent boredom. B. Reduce the need for catheterization. C. Prevent pressure injuries and improve circulation. D. Increase appetite. Answer: C. Regular repositioning prevents skin breakdown and promotes healthy blood flow. When documenting care, the CNA should: A. Record only major events. B. Use general phrases like "resident did fine." C. Use black ink and be accurate and specific. D. Erase and rewrite if a mistake is made. Answer: C. Proper documentation requires accuracy, specificity, and permanent ink without erasures. Which of the following is not a responsibility of the CNA? A. Taking vital signs. B. Changing sterile dressings. C. Reporting changes in condition. D. Assisting with daily hygiene. Answer: B. Sterile dressing changes are outside the CNA's scope and must be done by licensed personnel. If a resident's hearing aid is not working, the CNA should first: A. Replace the battery. B. Notify maintenance. C. Report it to the nurse. D. Check that it is turned on and properly placed. Answer: D. Simple troubleshooting like checking placement and power can resolve many hearing aid issues. A resident who is visually impaired should be: A. Spoken to in a louder voice. B. Guided by holding their arm. C. Left alone to promote independence. D. Pushed quickly in a wheelchair. Answer: B. Guiding a visually impaired person by allowing them to hold your arm provides safe navigation. The CNA overhears another aide shouting at a resident. What should the CNA do? A. Report the incident to the nurse immediately. B. Ignore it to avoid conflict. C. Join the conversation to calm the resident. D. Confront the aide later. Answer: A. Abuse or potential abuse must be reported immediately according to facility policy and law. A resident refuses to bathe. The CNA should: A. Force the resident to maintain hygiene. B. Tell the supervisor to handle it. C. Respect the resident's right and try again later. D. Bathe the resident while they are asleep. Answer: C. Residents have the right to refuse care. The CNA should attempt again later and notify the nurse. When using a gait belt, the CNA should: A. Place it under the arms. B. Apply it loosely for comfort. C. Position it around the waist, snug but not tight. D. Use it only when transferring to bed. Answer: C. A gait belt should be securely placed around the waist for safe mobility assistance. Which of the following residents is at highest risk for developing pressure ulcers? A. A resident who ambulates daily. B. A resident with urinary incontinence and limited mobility. C. A resident who drinks plenty of fluids. D. A resident who eats high-protein meals. Answer: B. Incontinence and immobility increase moisture and pressure, leading to higher ulcer risk. The best way to communicate with a resident who is hard of hearing is to A. Shout loudly into their ear. B. Speak quickly and clearly. C. Speak slowly and face the resident. D. Use gestures only. Answer: C. Speaking slowly and facing the person helps with lip reading and comprehension. Before feeding a resident, the CNA should always A. Warm the food. B. Check the resident's identification and diet card. C. Offer a snack. D. Mix all the food together. Answer: B. Verifying identity and diet ensures the correct resident gets the correct meal safely. When collecting a urine specimen from a resident, the CNA should A. Use any available container. B. Ensure the container is labeled with name and date. C. Wait until the end of shift to deliver it. D. Collect from the catheter bag. Answer: B. Proper labeling ensures accurate testing and avoids mix-ups in the lab. When performing perineal care on a female resident, the CNA should clean A. From anus to pubic area. B. In a circular motion around the perineum. C. From front to back. D. Side to side across the perineum. Answer: C. Cleaning front to back prevents bacteria from the anal area from entering the urinary tract. Which of the following is an example of a resident's right? A. The right to refuse treatment. B. The right to be physically restrained if confused. C. The right to administer medications to others. D. The right to leave without signing out. Answer: A. Residents have the legal right to refuse care or treatment, even if it is recommended. A CNA is helping a resident with left-sided weakness dress. Which arm should be dressed first? A. Right arm. B. Left arm. C. It doesn't matter. D. Both arms together. Answer: B. Dress the weaker or affected side first to reduce strain and make dressing easier. If a resident reports pain, the CNA should A. Ignore it unless it looks severe. B. Offer a hot pack. C. Report it to the nurse immediately. D. Tell the resident to wait. Answer: C. CNAs must report all pain complaints to the nurse for assessment and management. The CNA walks into a resident's room and sees smoke coming from a trash can. What is the first action? A. Remove the resident from danger. B. Pour water on the fire. C. Call 911. D. Evacuate the building. Answer: A. According to RACE protocol, the first step is to remove anyone in immediate danger. A resident is pacing and appears anxious. The CNA should A. Ignore the behavior. B. Offer to talk with the resident and listen to concerns. C. Restrain the resident for safety. D. Call security. Answer: B. Listening and offering support can help reduce anxiety and avoid escalation. The term NPO on a resident's care plan means the resident A. Can only have clear liquids. B. Is on a pureed diet. C. Should receive nothing by mouth. D. Can eat soft solids. Answer: C. NPO is a medical abbreviation for nothing by mouth. Which of the following would be considered a restraint? A. Bed rails that prevent the resident from falling. B. A resident voluntarily wearing a seatbelt in a wheelchair. C. A chair with a tray locked in place, preventing the resident from rising. D. A call light placed near the resident. Answer: C. Any device that restricts movement and is not easily removable is considered a restraint. What is the proper technique to remove a soiled gown from a resident on contact precautions? A. Pull it over the head. B. Roll it inside out away from the body. C. Toss it immediately into the hallway hamper. D. Cut it down the middle. Answer: B. Rolling the gown inside out minimizes contamination and follows infection control protocols. Which statement about confidentiality is correct? A. It's okay to discuss a resident's condition with other staff during lunch. B. Information about the resident can be shared with family without permission. C. Resident records can be read by anyone in the facility. D. Information is only shared with those involved in the resident's care. Answer: D. HIPAA laws protect resident privacy. Only those directly involved in care can access information.